Hi, welcome to Triad of Health Back Pain Center. We have Yvette here today who's helping out. Say hello, Yvette.
Hello.
And we're going to introduce you to the 7 secret causes of back pain that your back surgeon and chiropractor don't want you to know about, because if they knew about it, you wouldn't have the back pain anymore. Okay, let's go over back pain cause number 1 after this non-commercial break. The non-commercial break goes over how the language of talking to the body works. How does the language work? It works really well. We're going to check 3 nutrients that if the person is deficient in those nutrients, in this case it's Yvette, then we're not able to establish a good communication with the body. Nutrient number 1 is parotid PMG. Parotid PMG from Standard Process of Northern California, the oldest nutrition company in the United States. That was started by Royal Lee, who helped the United States military win World War II. She does not need parotid PMG. The muscle gets weak. The strong indicator muscle, resist my pulling out. The strong indicator muscle gets weak when we put the parotid PMG up to her body. To learn more about that, I would suggest the Hidden Messages in Water by Emoto, okay? Japanese researcher. Ribonucleic acid gets her weak, so she doesn't need that under her tongue. And Cataplex B12, also from Standard Process, gets her weak. Causes the muscle to weaken, so we don't need that one either under her tongue. Now, we can do the energy medicine diagnosis of the 7 secret causes of back pain, especially low back pain, that your chiropractor and back surgeon don't want you to know about. Number 1, we take a fist and we put it at the ileocecal valve and we check to see if there's a weakening. There's not, so she doesn't have trouble with her ileocecal valve. If there was a weakening, act like it's weak, then that would mean there's trouble with the digestion, the ileocecal valve, and we'd apply therapies. Luckily for you, my dear watcher of this video, we have over 12 different videos just on the ileocecal valve for you to be able to learn about what that means and how to get help with that. Aren't you lucky? I wish I had those videos and I was having trouble with my ileocecal valve. Okay, now we're going to take a fist and put it up to the valves of Houston, which is here on the left lower quadrant. And that one's strong, so she's not having troubles with her valves of Houston, another part of the digestive tract. The ileocecal valve is at the end of the small intestine where the large intestine begins. It's a valve that separates the two. Again, I have a bunch of videos on that. The valves of Houston is part of the anus. It's actually the upper part of the anus, the beginning of where the anus is. It's a valve at the end of the colon where the anus begins, so at the end of the sigmoid colon. Now we're going to take 3 fingers and put those 3 fingers here to check for blood sugar. So it looks like, ready? Okay, it looks like Yvette's blood sugar is okay. She stays strong when I put the 3 fingers there, which is great. And then we'll have you lie on your, actually stay there for a second. Okay, we're going to pull some hair gently. That was number 3. So we do an ileocecal valve, valves of Houston, blood sugar. We pull some hair lightly without hurting her and see if a muscle gets weak. This is checking for protein utilization. And it's coming from total body modification, the technique developed by Dr. Victor Frank. He passed away about 5-7 years ago or so. But when he was alive, he developed this amazing technique which has helped people all over the world for quite a while. Here's one of their manuals. It's now being run by a fellow named Kevin Millay. He's a chiropractor who purchased the company from Dr. Victor Frank, and it's being run out of Utah currently at the time that this video is being made. Now we're going to check something called rib torque. We're going to just take these fingers here and put them on the manubrium, and then we're going to twist them to the left, and we'll check the muscle, and it seemed okay. We twist them to the right, check the muscle, and it seemed okay. So Yvette's ribs are not torqued either. So far we've gone through ileocecal valve, valves of Houston, blood sugar, protein utilization, and rib torque. Okay, so we've gone through 1, 2, 3, 4, 5 things already. So we just have a few things left. Okay, go ahead and lie on your back. Just a few more causes of low back pain. Now, let's say I was watching this video. I'm just doing the video. I'm not watching the video. But if I were watching this video, I would be thinking to myself, what in the world do these things have to do with low back pain? Well, the simple but concise answer to that question would be everything. If somebody's having trouble with their ileocecal valve, often that's directly related to a herniated disc and all kinds of troubles that include heart pain, ankle pain, knee pain, and low back pain. We can check another point. This isn't one of the 7 secrets of low back pain that your healthcare provider doesn't want you to know about. Your healthcare provider most likely being a chiropractor or a back surgeon, but we can check an additional one. This one's called a neuro lymphatic reflex point that was developed by Frank Chapman. Frank Chapman was a wonderful chiropractor. Okay, and he found out about all kinds of different reflex points in the body. So if it's really, really painful in this point, then that's an active point that could lead to low back pain. So this may be painful. Okay, so is that at all tender in there, or a little bit? Mm-hmm. Okay, on a scale of 1 to 10, 10 being the worst pain you could ever experience and 0 being none.
1.
Oh, so yeah, so she doesn't really have that as an active point. She would have to say 5 or higher, or maybe it's not relevant because she could have a really high pain tolerance and just nothing hurts her because she might just be somebody like that. I don't think you're like that though, right? Yeah. She doesn't have an extremely high pain tolerance, so that's not relevant for this, for her, for Yvette. And then same thing here. Is that at all tender?
A little bit.
Okay. And on 0 to 10, how would you rate that pain?
1 or 2.
So again, that wouldn't be an active Chapman's reflex point, which is for the colon. And the low back pain is related to the colon. The traditional Chinese medicine, they found out that the L4, L5 area is directly related to the colon. And this excuse me to have my back to you. Sorry, that was a little bit rude. That goes back 5,000 years or so, about 2,500 to 5,000 years. It's hard to say how old Chinese medicine is, but the great book, that goes over this information is right around 3,000 years old. So not a lot more than 3,000 years old, about 3,000 years old, maybe even less old than that. I'm sorry, I don't have it. I don't have the book. Can't remember the exact age of the book. I think it's called The Great Pivot. I can't remember the name of the ancient text. Okay, we're going to check the psoas muscles. The psoas muscles are related to the kidneys. The main nutrient of the kidneys is water. So a way that I'll do this sometimes with people is I'll have them put 3 fingers on their tongue, and then if that weakens, then then they may be dehydrated. So go ahead and put these 3 fingers on your tongue. Don't let me pull down. Breathe in. Yeah, so with her, she doesn't weaken with that. So we're not really finding the dehydration that's checking for dehydration. Another way to do it is to check the psoas muscles. Now we're turning in the psoas muscles to see if they turn in evenly. See, her muscles do turn in evenly. That's a good sign. There's a good chance that her psoas muscles are balanced and functioning. It doesn't mean they are, because there's so many complicated things about muscle testing. It's kind of hard to explain why that is, but there's an excellent chance that they're balanced because we just checked them and they were balanced. So there may be a hidden imbalance that I'm not finding, but for now it seems that they're balanced. Push up into my hand here. Okay, breathing. Yeah, see, that muscle actually doesn't lock properly. It doesn't stay strong when I apply a force to it. And then push straight up into my hand here. And this one also doesn't lock properly. It doesn't stay strong. And then that's number 6. We just have 1 more left. Okay, so I could give her some water to drink, and then I could let her keep the water in her mouth and see if that were to strengthen those psoas muscles. And if it were to strengthen the psoas muscles, then that would give a strong indication that Yvette is dehydrated and needs more water. Another way to check for dehydration that your doctor might know about, actually, or they might not know about it. I'm not sure. I don't know who your doctor is, but you can pinch the back of the wrist and see if the skin stays there and doesn't just flip back quickly. It may be hard to see this on this video, but if the skin doesn't just spring back quickly, then the person's severely dehydrated. So Yvette's skin springs back right away. You want to take a look at that? So your skin comes back right away. It doesn't linger there. It just, well. Excuse me. Okay. Actually no, it does linger a little bit. See that? It doesn't come back right away.
Okay.
See on mine, when I pinch it, it just flips right back.
Okay.
Are you seeing that or not? Don't just say, don't just agree with me. You see when I pinch it, it just comes right back.
Okay, got it.
A little slow here where my big vein is, but in general it's just coming right back. So with you, see how it just kind of takes its time here?
Okay. I need more water.
So yeah, so hers aren't like my patients who are severely dehydrated, but she definitely has trouble with the elasticity of the skin there on the back of her hand. So that implies chronic dehydration. So let's actually do that. Let's take the water. Please don't turn off this video now. This is really, really important. Please, please, please. You're getting to the most important part. I know you don't normally see doctors begging you to do something, but this is important for you. If you live anywhere in the United States or Canada or anywhere in the entire European Union, please just watch this, please. Okay. So, and of course, you may be let down, and maybe it's just a waste. This is going to take less than 30 seconds of your time. So I'd highly suggest you just watch this 30 to 45 seconds or so. Okay? Go ahead and drink some water, and then leave some water in your mouth, and don't swallow the water that's in your mouth. If you need more water, I'm here ready for you. Okay? So, okay. Thanks, Yvette. So far we've only used up about 12 seconds of your time, so don't swallow that water. And, okay. So we'll see if we hurt her with the spring water. Okay, it seems like they're turning in evenly still. Go ahead and push straight up into my hand real hard. Okay, try it again. Yeah, that muscle's working properly now. Okay, I'm not just faking it, just keep pushing. Yeah, so I just keep pushing and pushing and pushing and pushing and pushing and pushing, and her muscle just resists the force that I'm applying to it. So this could definitely cause Yvette to have low back pain. Push up here into my hand. Pushing and pushing. This one not functioning quite as well. Push, push. Okay. Okay, push, push here. Okay, anyway, I thought you might like that. You can swallow the water, and then push your leg straight up into my hand here. Breathing. Okay, so that's called cardiac low back. The heart can also be affected by, the heart and low back pain are directly related. Dr. Viktor Frank, who developed total body modification, found out if somebody has something called cardiac low back, that these two hip flexors, when tested bilaterally, simultaneously, when they're weak, that oftentimes, not every single time, but almost all the time, the person has something called cardiac low back. And sure enough, when people have a severe heart condition, you'll often see that they're kind of hunched over. And even if they're not hunched over, they often will have low back pain. You'd have to know more about the heart and maybe be involved in healthcare to know about that. Or you could look it up on the internet if you want. Try putting up this hand with your elbow straight, and then push up into my hand here. Okay, there you can find the cardiac low back, the muscle weakens, even though it was pretty strong when she had her arm down. Push up here. Okay, so those are the 7 secrets of low back pain that your healthcare provider doesn't want you to know about, especially your chiropractor and your back surgeon. Thank you so much, and we'll look forward to seeing you soon on the next video.